Hello, everyone. Welcome to Therapy Clips with Dr. O. Our focus today will be on what is the connection between substance use and mental health. I'll give you a brief overview. A number of factors contribute to whether people develop substance use and mental health issues and to the severity of these issues once they develop. People's biology, their genetic makeup, that is, and the environment in which they live affect their functioning and well being throughout their lives. Biology and environment interact to create risk factors and protective factors. Biology and environment exist in different combinations for every person, resulting in greater or lesser chances of experiencing substance use and mental health difficulties and resolving them successfully. The biological factors is what we're going to talk about now. People's biology can affect how likely they are to develop substance use or mental health issues and how severe these issues can become. Biology refers to people's genes that are inherited from their parents at conception. Just like eye color, height, and whether people are likely to get certain diseases, such as heart disease, people also inherit the tendency towards certain personality traits or ways of thinking, feeling, and acting that make them more or less likely to develop substance use and mental health issues. Examples of biological factors affecting mental health and substance use. Some people may inherit a tendency to become more anxious than most other people do, putting themselves at greater risk for developing anxiety-related mental health disorders. Some people may be biologically predisposed to personality traits or ways of behaving that make it harder for them to stop drinking once they have begun using alcohol. People cannot change the genes that they inherit from their parents. However, the effect that genes have on people's lives is influenced by the environment. As a result, while it is more likely that people will develop difficulties that are difficult to deal with, but are similar to those of their parents, it is by no means a certainty that they will develop substance abuse or mental health issues. Question 1. Do people have control over the biological risks for developing mental health or substance use problems? The answer is no. But they can affect these risks through environmental changes. Now we're going to talk about some environmental factors. The environmental factors will exacerbate under certain conditions. So here are some environmental factors affecting mental health and substance abuse. Injury to the brain in the womb or during birth, exposure to drugs in the womb, exposure to toxins in the environment like lead paint, nutrition and health while growing up, certain areas in which people live, work, or go to school, any type of familiar, that is family and social type of relationships, environments that are unhealthy and that are stressful can often put people at greater risk for substance use or mental health difficulties. They can also make it more difficult to deal with mental health and substance abuse issues successfully. Question 2. Why would it be important for women to make sure that they eat healthy foods and not use alcohol or drugs during pregnancy? This is the answer. They want to avoid certain potential environmental risks to the fetus. Question 3. What are some ways stress could increase the chances someone will begin using drugs? Here's the answer. A person could use drugs just to relax, cope, or improve performance or functioning. So that's how stress can increase the chances that someone will use drugs. Now I want to focus on some risk factors and protective factors under the category of biology. So when you think of biology, the risk factors are having a close relative with a certain disorder, personality traits are high risk, gender, and also ethnicity. Some of the protective factors is having no family history of substance use or mental health problems, and having adaptive personalities. Some of the environmental risk factors are life stressors, relationship issues, health and mental health issues. Some of the protective factors are using coping skills to reduce stress and receiving treatment for substance use and mental health issues. I want you to understand that substance abuse can lead to mental health disorders, and mental health disorders can lead to substance use. When we think about the biological risk factors, people inherit certain genes from their parents that make them more likely to develop mental health and substance use issues. Although the likelihood of developing one of these problems, if one or both parents have the problem, is not 100%. People whose parents have substance use and mental health problems are at greater risk for developing them themselves. Here are some statistics. It's based on if you have a parent or a sibling with a mental health disorder. If a person have a sibling or a parent with major depressive disorder, they're 1.5 to 3 times more likely to also have a major depressive disorder. In the case of panic disorder, they're 4 to 7 times more likely to develop panic disorder. Bipolar disorder, they're 4 to 24% more likely to develop bipolar 1 disorder. And if they have schizophrenia, they're 10 times more likely to develop schizophrenia if they have a parent or a sibling with schizophrenia. Question 4. If people cannot change the genes they inherit, how can society expect them to take responsibility for treating mental health and substance use problems that they may inherit from their parents? The answer is they still have control over the environmental risks and protective factors. Both greatly affect the extent to which someone suffers from substance use and mental health disorders. However, when you receive treatment, then you can change your environmental factors and learn how to cope with them. So we're going to focus on our environmental factors again. In particular, we're going to look at the life stressors: work, moving to a new place, being unable to pay bills, or not having enough money, or having too much money, being a victim of a crime. Housing problems and legal problems are life stressors that will cause someone to use alcohol and drugs if they are susceptible to coping in that particular way. As far as the relationship category, that may cause someone to use particular substances: the death of a loved one, divorce, separation, and sometimes when they get into a new marriage. Also, parenting difficulties, arguments among family members, having few or no friends, having friends who use drugs or alcohol, and grief. Some health and mental health problems that could lead to substance use or other types of mental health problems can result from injuries, illness, accidents, not getting enough rest or not eating well, caring for a sick relative or friend, not dealing with their feelings effectively, going out to abuse alcohol or drugs, and experiencing certain mental health symptoms. When we think about protective factors, the protective factors are those factors that buffer against the risk factors. So while risk factors make people more prone to experiencing substance use and mental health issues, protective factors serve to buffer or shield people from the effects of the negative things going on in their lives. As a result, protective factors can help prevent or lessen substance use or mental health issues. So, the biological protective factors fall into the category of adaptive personality traits. Now, these adaptive personality traits help people to bounce back faster from depressing events that happen to them. Likewise, people also could inherit a tendency to deal more effectively with anxiety-provoking situations that help them to protect themselves from anxiety-related disorders. Now, when you think about these environmental protective factors, what we think about are coping skills. And these coping skills fall into the category of effective communication, learning problem-solving skills, developing a good support system, maintaining employment and a meaningful day-to-day routine, participating in recovery and support meetings, practicing relaxation skills, and learning to enjoy life. When we think about the treatment of the substance use and mental health problems, what we have available so far is medication, individual and group psychotherapy, and support groups. So, now I would like to highlight once again, we've been through this before if you've been in treatment with me, that there are different types of psychoactive substances that are out there that people use frequently, and it can lead to long-term and short-term effects. I won't go through the long-term or short-term effects in this presentation because if you've been in treatment with me before, we've been through that already. But I will tell you the category of the substances and give you an example of each. Alcohol comes in the form of beer, wine, hard liquor such as vodka, scotch, whiskey, gin, rum, and tequila. Cannabis, here's your marijuana and hashish. Stimulants include cocaine, amphetamines. Sedatives are anxiety lowering medications. Comes in the form of your benzodiazepines and your barbiturates. Narcotics are your heroin, morphine, opium, and codeine. Inhalants are your glue, aerosols, nitrate oxide, and freon. Over-the-counter medication is antihistamines such as Benadryl and other cold tablets. Tobacco includes your cigarettes, pipe tobacco, chewing tobacco, and snuff. Caffeine includes your coffee, tea, and chocolate. And you have anti-Parkinson agents that's out there such as Cogentin and Artane, Symmetrol. These are the things that people are using. Some are with prescription and used appropriately, and some are not used appropriately. I just want to say, be careful what you do to your body. So, in summary, people's biology and the environment in which they live and work make them more or less likely to develop substance use and mental health issues. Biology and environment affect how severe these issues can become. Specific combinations of biology and environment influence how people think, feel, and act, and are called risk or protective factors, depending on whether they increase or decrease a person's well-being and functioning. Substance use and mental health issues can be the result of other risk factors and can themselves be risk factors for each other or other problems. Seeking treatment for substance use or mental health problems can reduce people's risk for further types of problems that they may encounter. And this is considered a protective factor. Effective treatment for substance use and mental health problems includes medication, individual and group therapy, and support group. I'd like to thank you for your time. Have a blessed day. Until we speak again, love always.